Hello, everyone, and welcome to this recorded session on the impact of mental health first aid. I'm really sorry that you couldn't attend the live event that we did, but we didn't want anyone to miss out, so we've done this little recorded version so you can listen back at your leisure. Now, you might be coming to this already having mental health first aiders within your organisation. You might not have mental health first aid training in place and you might be considering it. Whatever approach you're coming from, I hope there's going to be something useful in this session for you to take away and have a look at. And hopefully it will help you. Oh no, that video stopped recording. So let's do that again, shall we? Hello, everyone, and welcome to this recorded session on the impact of mental health first aid. I'm sorry you couldn't make the live session that we did, but we didn't want anyone to miss out, so we've done this recorded version so that you can listen back at your leisure. Now, you might be coming to this from a place where you already have mental health first aid in place within your business or organisation, or you might be coming to this without any mental health first aid training and you're considering it and you're wanting to know, actually, is this something that's going to add value to my organization? Whatever approach, whatever perspective you're coming from, I hope there's going to be something useful in this that you can then take away and hopefully implement within your own organization. There's quite a lot of things we're going to be covering in this session, so I apologize for the fact that we're trying to cover quite a lot in a short space of time. But we want to firstly understand what mental health first aid is. And obviously, if you've done mental health first aid training, if you have that in place within your organisation, you may already be familiar with that. But we're going to cover those bases for those who maybe aren't as familiar with what mental health first aid is. I have abbreviated mental health first aid to MHFA within this session, just because there's only so many times you can read the words mental health first aid and it takes up a lot of space on the slide. I've shortened it down where possible just to make it a bit easier for yourselves to read. We're also going to be looking at how mental health first aiders contribute to a healthier and more engaged workforce. There'd be no point doing mental health first aid training if there wasn't some tangible benefit to it. But I think it's also important for us to understand what those benefits are, how they contribute to a healthier workforce. We're going to look at the business case of mental health first aid, and that's not just about understanding compliance and why we have to have support in place, but also going beyond that. And we're going to look at sort of four key areas for that. We're going to look at what a good mental health first aid program looks like. Because is it enough just to train up someone in mental health first aid and then say, right, off you go, get on with it? Well, actually, there's a few more things we need to consider in order for it to be considered a good mental health first aid program within our business. And signs that your mental health first aid program is working effectively. It is a significant investment to make training mental health first aiders. You kind of want to know that it's working. Or if it's not working, you also want to know that so that you can make adjustments so that it becomes more effective. So we're going to look at some of those signs that actually this is how you can know it's working. And these are some of the things actually you can do to improve that efficiency, to make them more effective. So we're going to cover quite a lot in this session. The starting point is just understanding what mental health first aid is. So I want you to imagine a scenario. You're at work and unfortunately you have a pretty bad fall. And it's quite bad. You hurt yourself quite significantly. What do you imagine is the next step? What do you think is the first thing that happens if you're in a workplace environment and you physically hurt yourself? What might occur? Hopefully, you have physical first aiders in place. And someone will come along, a physical first aid will come along and check you out and provide that initial first line support so that you are supported in that moment, but also the next steps are taken care of as well. What kind of support do you need? What care do you need in that moment? Is this just a simple case of the mental health first aider can just help patch you up, or do you need to go and seek professional help for this? But generally speaking, it will be a mental health first aider that is that first point of contact. And many of us are familiar with physical aid for first aid for physical health. It is that first response to someone in need. It is assessing any risk to that person. Is there any risk of further injury to them? It's providing those basic first aid skills to help assist them in that moment and then getting them to the right kind of professional support should they need it. And many of us are familiar with first aid for physical health. But interestingly, if we change that from first aid to for physical health to first aid for mental health, don't really need to change any of those bullet points at all. It's still about providing that first response to someone who's in need, someone who's in distress, maybe. It's assessing the risk to that person. Are there any further risks that might actually make their health worse or impact on their well-being further? It's providing those basic first aid skills to assist them. The difference being that with physical first aid, that's things like elevating limbs and providing support and treating cuts and wounds and things like that. But for mental health, with mental health first aid, that's applying things like listening skills, empathy, compassion, congruence. It's listening effectively to someone without judgment so that they feel heard and valued and that they can then take the next step if they need to. And it's getting them to professional support if needed. So when we think about what mental health first aid is, it's not too dissimilar from physical first aid. It's being that first line support, providing help for someone in distress and getting them to the right kind of professional support should they need it. Now, there's a few things to understand about what mental health first aid isn't. And I think that's a kind of important thing to understand as well, because some organizations may think, well, if I've got mental health first aiders, I don't need professional support because they can deal with it. I don't need to have a wider understanding around mental health within my business because these people are taking care of it. It's not designed to make your employees counselors or therapists. A mental health first aid course is a 2-day course generally, and that's not enough time to make someone a counsellor or a therapist. And actually, it'd be very dangerous if we were expecting mental health first aiders to be counsellors and therapists. That would be quite harmful. We're asking them to do something they're not trained to do, and there is the risk of causing more harm. So it's not a substitute for that professional support. And that's a kind of similar thing when you think back to, again, to physical first aid. If you'd had that fall at work, and let's say your physical first aider is Bob, and Bob comes along and he goes, oof, yeah, I don't like the look of that. I think, you might have dislocated your ankle. It's looking pretty bad. In fact, it might even be broken. I tell you what, we need to get you to hospital. We need to get you checked out. And you go, right, okay, then. Well, clearly I can't drive. We'll get an ambulance for you. And then someone helps you to the front entrance, and there's Bob in his car, and he pulls out one of those flashing blue lights and sticks it on top of his car and goes, "Come on, then, right? It's fine. I've seen TV shows. I can be an ambulance driver. Don't worry. Hop in the back. I'll get you there. Don't worry." You might feel a little bit tentative about Bob being your ambulance driver, might you? And then you get to hospital, you get checked out by the nurses, and they go, yeah, unfortunately, we've sent you for x-rays, we can see it's broken. We're going to need to put your leg in a cast, I'm afraid. Here you go, we'll wheel you in so you can do it. And you wheel into the room where your leg's going to be put into a cast, and there's Bob. And he's like, don't worry, I can do this. I'm a physical first aider. I can put your leg in a cast, don't worry. You probably don't want Bob from accounts putting your leg in a cast. You don't mind Bob being the one who's initially assessed you in the workplace when you've had that fall and saying, look, this looks quite bad. I think you need to go to hospital. But you don't want Bob to be your ambulance driver, and you don't want to be the person who's putting your leg in a cast either. So we have to have these sort of separate roles. We have to understand that mental health first aiders aren't there to be professional support, and they're not a substitute for professional support. Depending on the size of your organization, it's really important to have access to professional support. Even if actually you're a small organization, it's still important to be able to have those avenues where your employees can access professional support when needed. So it's not going to make them counselors or therapists, and it's important we're not encouraging that. It's not a substitute for preventative measures as well. It's not often to go, well, we've got mental health first aiders, so if someone gets into crisis, well, they'll just deal with it, won't they? In an ideal world, we don't want them to get to crisis. So it's not a substitute for those preventative measures that can be put in place. Prevention is always going to be better than cure. So it's really important that actually we're still working to understand some of the risk factors within our business, understand what causes our employees stress. Can we do something about that? Can we risk assess around mental health within our business? That's risk assessing is something that we don't often do, is it? That we tend to do risk assessments for physical health and safety, but we don't tend to do risk assessments for mental health. But actually, we really should, because all of that is preventative measures that are going to stop someone getting to that crisis point in the first place. It's also important to recognise that it doesn't allow a mental health first aider to make a diagnosis or to prescribe treatments such as medication. We don't want our mental health first aiders to be making a diagnosis. Making a diagnosis is a tricky thing. Doctors get it wrong all the time because it is so incredibly complicated. And when it comes to mental health, even more so. There are 265 recognizable, diagnosable mental health conditions. We can't expect someone who's done a 2-day course to know all of those and to understand all of those and the subtle nuances between them. And I think when it comes to mental health, that's really important because mental health can be very unique. If you fall over and break your arm, well, the symptoms you're going to be experiencing, the treatment you're going to have is going to be pretty similar to someone else who's broken their arm. But if you've got someone who's experiencing depression or anxiety, the symptoms they experience might be very different to the symptoms someone else is experiencing, even though they might have the same diagnosable condition. So we're not wanting mental health first aiders to make a diagnosis. And it's always a key part of the training where we say it's important to understand the signs that someone is struggling. It's important that we're not making a diagnosis and not making a judgment of that. And they're not there to provide treatments such as medications, not even there to prescribe therapy. They're there to sort of suggest the options that are available to someone, but it's down to the employee to choose what they think is going to work for them. So it's important we recognize that as well. So that's what mental health first aid isn't, but actually, what is it? What does it provide? Why do we have it in place? Firstly, because it's that increased support for your employees. I think it's hard to expect managers or HR staff to be the people who are taking that burden on of supporting people who are struggling. I think we need to have people who are trained to be able to have those conversations. And mental health is not something that we talk about. I think we've gotten much better at that over the last 5, 10 years, but it's still in a place where there's a lot of stigma attached. And so it's important that we've got those support networks available for employees. It also means there are more opportunities to notice when someone's not okay and to get that early intervention. If you're a mental health first aid and you've been trained to spot the signs that someone is not okay, maybe someone is stressed or burnt out or they're experiencing anxiety or depression, if you can spot those symptoms sooner, you can have that conversation with someone. Say, look, I've noticed that actually you don't seem to be okay at the moment. You seem a little quiet. You seem a bit distant. Is there anything you want to talk about? And it provides that opportunity to intervene early, which is what we want when it comes to mental health. Early intervention is key. It stops things from getting worse. It stops things from having a knock-on effect on our business and organization. So it gives that opportunity for that. It gives increased awareness around mental health throughout the organization. Just the fact of being a mental health first aider, you might have someone come up and say, "Oh, I can see that you're a mental health first aider. I don't know what that is. Tell me about it." And what it does is it just gives people an opportunity to talk about mental health. And if actually you were struggling within your business and you had someone that you knew had been trained around mental health, you might feel more comfortable to go and talk to them about it because actually, I feel like you maybe have the skills to understand what I'm going through. You might be able to help me, but I also feel like maybe you're not going to judge me for this either. So that stigma that still exists, it helps to just remove some of that. It makes talking about mental health much more approachable. It's also a reduction in serious mental health conditions because we're getting that early intervention. It's not building and building and building to the point where somebody is really in crisis. They need to take time off work. It's going to take them a lot longer to recover. So actually somebody who's just feeling a little bit stressed but can get support for it early on means it doesn't become burnout. Or someone who's feeling just a little bit more anxious, it doesn't become full anxiety if it can be dealt with earlier on and some support can be put into place. And it just helps to reduce that stigma around mental health. As I say, we've gotten a lot better when it comes to talking about mental health, but stigma still exists. And I think we have to kind of recognize that. Mental health first aiders play a key role in being able to reduce that stigma because they're people who are willing to talk about mental health, willing to have these conversations. And that's such a key thing within our business to getting to removing some of that stigma that still exists. So there's lots of positive things that it does provide. I think it's also important to recognize that having mental health first aiders gives people that point of support that maybe they feel more comfortable to access. So this comes from a study that was done just about a year and a half ago, and it was looking at how many people would talk to their line manager if they were struggling with their mental health. What percentage of employees? You've got a whole list of numbers on screen there. We need to take a moment. You can pause this video if you like and just have a think. What percentage do you think it is? What percentage of your employees do you think would go and speak to their line manager if they were struggling? Hopefully, you've got a number locked in. And Take away a few of the options. Is your number still on screen there? Take away a few more. Starting to narrow the field down a little bit now, but there's still some high numbers in there. Take away a few more. Take away a couple more. Statistically, it's about 19%. About 19% of employees would speak to their line manager if they were struggling about their mental health. And I think this is a really important thing is that we often expect our managers to be able to look after their teams, to look after their team's well-being. We give them that responsibility. A lot of managers often don't feel trained in that. And that's where I think managers' mental health training can be really important so they feel better equipped. But employees need to feel that they can go and speak to someone. And actually, if quite a significant proportion don't feel they can talk to their manager, those people might feel more comfortable talking to a colleague. And this is why we'll talk about mental health, who your mental health first aiders should be later. It's important to have a wide range across the business at different levels because it's no good having just managers as mental health first aiders because if we don't feel comfortable to go and talk to them, well, we're removing that opportunity. But people are more likely to talk to a colleague and they're more likely to talk to a mental health first aider than they are a manager. If you're working in HR, and I know quite a few people who joined the call, the live version of this, were working in HR, I'm really sorry to say, only 4% would go and speak to you. And I think sometimes that's the perception that HR is representing the company, despite the fact that actually you're there to represent the employees as well. I think it's the perception sometimes is the stigma and the barrier that gets in the way, not necessarily the reality. It's just how people perceive it. But if you're working in HR, you're very unlikely to have someone choose to come and talk to you about how they're feeling. So we need to provide other avenues of support. We need to have people there that others feel comfortable to have those conversations with. And it all comes back down to that early intervention because mental health can very easily and very quickly become a domino effect. You have a few bad days and then something else happens and then something else and then it's a bad week and a bad month and before you know it, that little bit of stress you were feeling, all of a sudden you're starting to feel burnt out and exhausted, and then that's starting to affect things like your mood, your sleep patterns, your eating patterns. You're starting to get depression symptoms and it's just building and building and building and the dominoes just keep falling. But if someone recognizes early on, are you okay? You don't seem okay, and can have that conversation, we can stop the dominoes from falling. We can stop things from getting worse. And that's a big part of what mental health first aiders do, is they can spot the signs when someone's not okay. Because mental health is very different from physical health. If someone comes in and they've got the flu, you can tell pretty quickly. Sometimes just in the way they look, but the way they sound, the coughing, the sneezing, the bright red nose, we can tell when someone's got the flu. And if someone broke their arm, you'd be able to tell because their arm's in a cast, probably. You'd be able to spot physical health symptoms much easier than mental health ones. But if you've got people who are trained to spot some of the subtle signs, just the language that people use, their body language, their demeanor, if they can spot those and can just pull someone aside and say, I've noticed you don't seem yourself lately. Is everything okay? Is there anything you want to talk about? It's that early intervention again. But it also helps to reduce the stigma when you have someone saying, it's okay to talk about this. It's quite a normal thing, actually, with everything you've told me you've got going on in your life, that you would be struggling. Of course, you feel stressed with everything going on. Of course, you feel a bit down. They can normalize having these emotions and these feelings. And that's particularly important when we think about some of the stigmas that exist around mental health. How many of us have been raised with messages like boys don't cry and man up? So again, if you've got workforces that are predominantly male, there's a lot more stigmas and messages there that say it's not okay to talk about certain things. Having someone say, you know what, it's understandable that you'd feel this way. And it's okay that you feel this way. You're not wrong for struggling. You're not wrong for feeling sad or feeling down or feeling just more anxious than normal. It's just not okay that you continue to feel like this. So let's look at what we can do to help. It helps to reduce those stigmas. It helps to encourage open conversation because if I'm struggling with my mental health and I go to a mental health first aider and I have a really good conversation and I feel listened to and heard and validated, I'm going to take confidence from that and I might then feel like I can go and talk to someone else. If I can talk to that person and have a good experience, maybe I could have a good experience elsewhere. Maybe I will go to my manager. Well, maybe I will go to HR. Maybe I'll be able to talk to family or friends or go to my GP. But I have to have that good experience first. And too many people have had negative experiences when it comes to talking about their mental health, that they've tried to talk about it and someone's gone, well, what have you got to be depressed about? Or just pull yourself together. Or the one that's very common is, yeah, but it could be worse, couldn't it? Oh, you've got a lot of stress at work. Yeah, but at least you've got a job. And it just kind of takes away the fact that actually it's okay to struggle. And if that's the response I've had before, well, I'm not likely to go and seek out other support, am I? But if I can have a positive experience with someone, if I can feel heard and validated and listened to, I'm more likely to go and try and get support from elsewhere. And again, that's that early intervention. It stops things from building and getting worse. And mental health first aiders play a key role in that. It also means that we're placing emphasis on the employee to look after themselves as well. Part of what a mental health first aider does is tries to understand someone's experience and what they're going through without judgment or criticism, helps them to understand what professional supports are available, but it's also about encouraging their own self-care. So a mental health first aider will be saying, what can you do to look after yourself? What kind of things can you do that take care of yourself rather than necessarily falling into bad coping strategies? What are some of the positive things that you can do? And this is really important because whilst we all have a duty of care to our employees, there's a very valid question about to what extent does that duty of care extend? So, as a business, how much support should you be providing? And actually, how much emphasis should be put on the employees looking after themselves? I would say it's not the business's responsibility to solely take care of an employee's well-being. The employee has a role in that too. We have to have a little bit of ownership and take care of ourselves. And mental health first aiders do that. They encourage them to promote autonomy and ownership of what they're going through, but also to help empower the employee to go and take steps, to go to their GP, to look at self-care routines, to look at maybe some negative coping strategies that they've developed and how can they change them. So it puts some of that ownership back onto employees as well, which is so important. And all of that means that people are less likely to get to a point where they're in crisis. Now, that's all the benefits of mental health first aid. Also, I want to look at the business case for it as well. And if you're thinking about mental health first aid training, hopefully this will help sort of persuade you that this is a very valid thing to do for your business and it's worth investing in. If you've already done mental health first aid training, hopefully you'll be looking at this and understanding that, yes, this was a really good investment for us. How do we make the most out of this? Before I look at sort of beyond compliance, I think it's important that we do touch very briefly on compliance itself. We all have a responsibility to protect our employees' mental health. It comes under duty of care. It's under the Health and Safety at Work Act. The thing about the Health and Safety at Work Act is we tend to focus on sort of the physical side of things and we tend to focus on the safety part, don't we? How do we prevent accidents? How do we prevent slips, trips, falls, things like that? We don't tend to think about the Health and Safety at Work Act in terms of mental health, but it's always been there. It's always been a part of it. And it's that duty of care. But a good question is how do you demonstrate duty of care? How can you demonstrate that as an organization you are looking after your employees? And that's a big part of where mental health first aid comes in. That you can demonstrate we have mental health first aiders in place. We've made this investment, we've made people available to have conversations, to provide support, and to signpost on to the right kinds of professional support as well. We are demonstrating our duty of care by having this in place. So, mental health first aid is a demonstration of duty of care in practice. So, I think for that reason, for that compliance reason, it's important. The other question I've got for you is do you think it's a legal requirement to have mental health first aiders in your workplace? Might be something that you may be familiar with, you may not be familiar with. I don't expect people to be fully aware of what's kind of going on within the political climate around mental health first aid at the moment. At the moment, it is not a legal requirement, but it is something that I believe in the next few years will become a legal requirement. It's going through the sort of process of becoming legislation at the moment. And so far, for these first sort of two steps of kind of just getting through the legal process, it's passed through completely unimpeded. Nobody is saying actually this is not something that we should be doing. People are saying, well, look, we have a requirement for physical first aiders on site, we actually need to have a requirement for mental health because under legislation in the UK, there is a parity of esteem between mental health and physical health. What I mean by parity of esteem, if you're not familiar with that term, is basically mental health should be treated exactly the same as physical health is treated. And therefore, if we should have physical first aiders, the argument goes that actually we should have mental health first aiders as well. So the legislation is starting to move through. Like with any legislation, that takes a bit of time, and obviously changing of governments and things like that just adds a little bit more time to that. But I anticipate within 3, 4 years or so, we'll be at a place where actually businesses are required to have mental health first aiders. And inevitably, what happens at that point is there'll be a mad scramble for people to do training and get things in place. And that's fine because you're trying to comply with the legislation, but it's much better to be ahead of the curve. It's much better to have mental health first aiders in place, embedded within your organization, part of the culture of your organization, who are then helping to shape the culture around mental health so that when it becomes legislation, you're already there. There's nothing you have to do. You're already complying with it, and actually you have a really effective program in place already. So it is something that we believe will become legislation at some point in the not too distant future. But what about beyond compliance? So take out the moral and legal obligations under duty of care. Why should we invest in mental health first aid? And there are four key benefits to this from a business perspective that I want to touch on. So we have things like return on investment, we have reputation of the company, we have improved performance, and we have staff retention and staff recruitment. I'm going to look at these in a little bit more sort of detail with you, just so that you get a bit of a better understanding of each of these four. Let's start with improved performance. There was a study done again a couple of years ago now that said happy and healthy employees are up to 13% more productive than those who are just okay. So happy and healthy employees, not even against people who are not happy and not healthy, just against employees that, yeah, I'm fine. Happy and healthy employees were found to be 13% more productive. So that's when you think about your workforce, think about the output from your workforce. Let's just narrow that down from 13 to 10. Let's just say 10%. If you could improve your productivity by 10%, you'd take that, wouldn't you? What would that be worth to you? What would 10% more productivity be worth to your business? Now, the likelihood is actually 10% more productivity, probably going to be quite valuable, certainly more valuable than the cost of doing mental health first aid training. And again, if we can have that early intervention, have that support, employees can feel that actually they're taken care of, they're valued. And it's one of the things that employees care about the most when it comes to an employer is, do they feel cared about? Do they feel valued? If I'm coming and giving hours and hours of my life to this job, do I feel like I'm doing it for someone who genuinely cares about me and someone who's going to be there when I'm not okay? And that's what mental health first aid does. Engagement and productivity are very closely linked to mental health. That you will all know this. I can imagine all of you will have had an experience of this when you're having a day where you just don't feel yourself. You're just feeling a bit down or a bit sad or just really stressed and you're finding it really hard to focus. I've done it before. I know when I'm starting to feel quite stressed that I'll be sat there looking at an email on screen and 10 minutes will have gone by and I cannot figure out how I'm responding to this. And it's literally, it might require just a one sentence or a one paragraph answer. It will take me 30 seconds to do at most. But in that moment when I'm really stressed, my brain is going, I'm looking at what they've said and I know I need to respond, but I can't find the words for it. I don't know what I want to say. For whatever reason, my fingers and my brain just don't feel very connected at the moment. And that can take me like 10, 15 minutes to respond to something that should be 30 seconds. I know that when I'm very stressed, I'm not as productive. And many of you will have had that experience too. So the more we can provide that support, the happier and healthier we can have our employees, the more engaged they are, the more productive they are. It's also that knock-on effect they have on colleagues as well. If you've got someone who's very down, who's very sad, very low, might be using very negative language as part of that. If you've got someone in your team who's using very negative language, what's the point? Oh, we've been told to do this. Why have we been told to do that? What's the point of it? Oh, well, we're never going to hit that deadline, are we? Never going to hit that target. it has a knock-on effect on people around us. So it isn't just the individual who's struggling, it can have a wider knock-on effect on a team, and that can affect a team's engagement and productivity. If we can have well implemented and effective mental health first aid programs, that has been shown by studies to improve employee happiness, it improves their overall well-being. It also not just improves their mental well-being, it also improves their physical well-being as well, because mental health and physical health are very closely linked, very related. They connect with each other and one influences the other. So good mental health first aid programs also improve people's physical health. That enables them to be more engaged. That enables them to be more productive in their role. So that's one benefit that we have from it. Second one is just staff retention. So statistically, it's about 5 million people in the UK leave their job. Some of them leave for another job, some of them just leave employment altogether. It's estimated around 300,000 people leave their jobs per year due to mental health. It's about 6% of all people leaving. Now, interestingly, what's the cost of that? You think, well, if someone leaves, is there a cost to it? According to recent research, the average cost of replacing an employee in the UK is around £25,000. And it can be as much as £40,000 for specialists and senior roles. So, what that kind of comes down to is firstly, you've got to recruit someone for that role. There may be recruitment costs in that, depending on what avenue you go down. There might be training costs for someone that you're bringing on board. You're certainly going to have a period of time where you're waiting to replace that person. So during that time, how is that work getting done? That might be that other people are expected to pick that up, and that means that some of their work isn't getting done. So you lose productivity somewhere if you've got to cover it here. You probably lose productivity in that person's role as well, because even if someone's covering, they might not be covering it fully. You might find that actually you're having to pay people overtime to cover some of the work. So you've got additional costs there. And even when someone comes on board, there's a period of time for them to be trained up, to get settled into the role. Even if it's someone who's done that role somewhere else previously, there's always a transition period where in that moment you're not as productive as you might be. There can be a loss of reputation there if the continuation of a service is impacted by someone leaving. And all of that comes together to add up to this kind of £25,000 cost. So it's really not a good idea for us to lose people, is it? We want people to stay with us. We want people to stay engaged with the company. And quite a significant percentage of people leave because of mental health. Now, that 300,000, the one caveat I've put an estimated because the reality is, how many people leave because of their mental health, but they don't feel they can be honest about it? Because actually, if you then have to go to another job and they say, well, why did you leave? Well, you don't really want to say mental health, do you? Because there's still that stigma there of, well, you might not give me the job if you think I can't cope with my mental health. So there's still so much stigma around that that people who are leaving may not give valid reasons for it. And so 300,000 is probably a conservative estimate. But there was a lot of people who are having to leave their work because of their mental health. If we can help support their mental health, they don't have to leave. Not only are they more engaged, but they don't get to a point where they feel that they need to leave as well. And that's where effective mental health first aid programs come in. It helps to reduce employee turnover. Employees feel more supported and valued as well. Even if they don't kind of use it, even if they never struggle with their mental health and they don't need to access support, the fact that they know that you care enough as a company to put that in place, that increases that sense of loyalty they have to the company because, well, I know that if I was struggling, I know that support would be made available. I know the company would understand and they'd do everything they could to help me get back to feeling healthy again. So it can be really effective in staff retention. It's also around reputation as well. So this is where sort of staff recruitment comes in. Employees coming into companies and organizations are much more discerning now than they used to be, and their motives for taking a job are very different. A lot of the time it used to be location and salary. Those were the two big ones is it far for me to travel and how much am I getting paid? Now there are so many other considerations that go into that, whether that's flexible working, but a big factor of that is mental health. There's a recognition that actually my mental health is really important. How are you going to support me with that? And it's one of the things we always encourage in mental health first aid training is if you are responsible for recruitment, be bold and be demonstrate the mental health support that you have in place because not when you're doing an interview with someone, yes, you're interviewing them, but they're also interviewing you. why should I come and work for your business? Well, actually being able to say, if you are struggling, there is support available. We have mental health first aiders. We have an employee assistance program. We have these mental health initiatives. It just gives someone a sense of, okay, this is a company that cares. And reputation is really important. Reputation is also important to our customers, the people buying our products and services. So actually, we want to have people want a supply chain that fits with their values and ethics as well, and that's becoming something where people are much more discerning now than they used to be. Again, it used to just come down to price. Now, for a lot of companies, it's well, I want my suppliers to take care of their staff. I want them to have good morals and ethics. And this is another way of just being able to demonstrate that. So it can have a big impact on things like reputation as well. The last one, and it kind of sort of takes those first three and sort of ties it all together, and that's when it comes to return on investment. I mean, return on investment is a tricky one because how do you measure return on investment for your mental health first aid training? It is a complex process, hence the reason I haven't done it, but Deloitte have. And they kind of know what they're talking about. So I trust what they've done in terms of looking at this. And what they found is that the return on investment for mental health initiatives, including mental health first aid, is 5 to 8 times the initial outlay. Whatever you've spent on mental health first aid, you can expect 5 times the return on that. And that's where it comes to increased engagement, increased productivity, less absenteeism happening for that, less presenteeism, where people are turning up to work and really they're not okay, but they're just kind of getting through as best they can, but they're not firing on all cylinders. They're more likely to make mistakes. It's having a knock-on effect on productivity, but they don't feel like they can take time off or take care of themselves. So presenteeism can actually be more costly than absenteeism. If absenteeism is about taking time off and getting well and coming back and being able to be your normal self, that can actually be okay, or certainly less costly than presenteeism. But all of those things, staff not having to leave and needing to be replaced, the return on investment is 5 to 8 times. If we go back to staff leaving, if we say the impact of that is around £25,000, if mental health first aid stops just one person from leaving, it's more than paid for itself. So it is about recognizing there is a financial return on investment. And I know that can sometimes be an important point for businesses. I'm spending this money on this training. It's not cheap. It's something that, is important. But how do I know that I'm getting value for this? And it's looking at that research and understanding actually there is a significant return on investment here. That doesn't include what I refer to as the hidden return on investment that I think is impossible to measure. And I say this to every mental health first aider that I train up. I say, if you do that role long enough, if you are a mental health first aider for long enough, you will save someone's life. You'll just never know it. That person, that employee who was struggling a bit, was feeling a bit overwhelmed, but didn't feel like they could talk to someone, so they just bottled it up and it just built and built. And then they started to experience depression symptoms, but again, they didn't feel they could talk to anyone. They didn't feel there was any support in place. So that just built and built. Then they started taking time off, coming into work late. It started to impact their job, their performance. They were starting to be performance managed because the employer didn't know that they were struggling because nothing was being said. They were just seeing the output and the performance and things going wrong, and then they just get worse and worse. It leads to suicidal thoughts, suicidal feelings, and then suicidal actions. There will be someone who, without the right support in place, would have followed down that path. But at some point in that journey, a mental health first aider said, "Are you okay? Do you want to have a chat?" And that took them off in a completely different direction, that they felt heard and validated, that they felt able to go and access support. They could talk to their line manager, they went to their GP, and after a period of time of support, they felt better and they felt themselves again. If you do the role of a mental health first aider long enough, you will save someone's life. I got no way of proving that. I have no way, there's no model that can help me to prove that. But I know as a therapist, as a mental health trainer, I know that that's the case. So that's the hidden return on investment, is it could save someone's life. And that's huge. So there are very valid reasons for doing this. And I think that's important to recognize that for any business, these things are valid. If you work in certain industries, the case for mental health first aid actually becomes much more important. It becomes vital. If you are in an industry where it's high stress all of the time, the risk of stress and burnout and overwhelm is much greater. It's much more important than to have supports in place. If you're an organization where you have a lot of remote working, and for some people, working from home, working remotely works very well for them. It fits in with their working patterns and things like that. The challenge you have is that if you're in an office with someone and someone's not their usual self, they're being a bit quiet, a bit distant, they look a bit sad, you can see those things and you can intervene. It's much harder to do when you've got remote teams who might feel very isolated. They don't feel part of something. They don't feel part of the organization because they're so remote. Again, mental health first aiders who can be proactive and engage in conversations ahead of time. So they're not spotting the signs and responding. They're checking in and saying, "Hey, how are you doing? Because, I know you don't get to be in the office very often and haven't seen you for a little while. I just wanted to know how you were doing." Those proactive measures can be so important. If you're in an industry where the risk of abuse or threatening behavior is commonplace, what we often find, and as at Red Umbrella, we do a lot of work with different organizations where this is true. And I remember speaking to someone some point last year, and they said, "Oh, we get abused all the time. We get shouted at, cursed, we get spat on. Sometimes it's physical assaults that we get and we have to deal with." And I go, "Well, how do you deal with that? How do you cope with that?" And the response was, and it was kind of jokingly given, it's like, "Well, I go home, have a good cry, and then I come into work and get on with it again." And they were kind of sort of said it in a jokey way, but actually there was an element of truth to that, that they just went home, had a good cry, but it was just kind of seen as, well, that's the job. That's just normal. And I think that's important to recognize that we can very easily normalize the things that cause poor mental health. High stress environments, well, that's just the job, isn't it? That's what you signed up for. Jobs where there's risk of abuse or threatening behavior. Yeah, but that's the job. You signed up for it. You knew what you were signing up for. That doesn't mean that actually it's okay. That doesn't mean that we don't have to do something about the risks and try and provide support. If you've got an industry with high rates of accidents and injuries, the anxiety around that in itself can be enough. But again, physical health can impact on mental health. If you've got an industry where there's high rates of suicide, we do a lot of work within the farming community. The farming community has statistically higher rates of suicide than a lot of other industries. Just actually that additional risk means it's so much more important to have mental health training and mental health first aiders in place. If you've got a business that has unique challenges and you're constantly having to change and adapt and change itself, actually, if you're a business or an industry that is constantly changing, that uncertainty, that has a knock-on effect for your employees. It's often very small, it's very subtle. We don't kind of notice the impact change has on us, but it's a very small fight or flight response that people get. Now, most of the time when something changes, I'll give you an example for that. Let's imagine your favorite app or your favorite website that you visit all the time, and then they do a sort of little bit of a rebrand and a refresh, and they change it, and they change how it's laid out, and they change how it looks. How many of us look at that and go, "Oh, I don't like that. I liked it how it was before." It's because we're used to how it was before. And actually, every time there's a bit of change, we go, "Oh, I don't like that." And we get used to it very quickly. But that, "Oh, I don't like it," is the fight or flight response that change brings about in people. Often it's so small, so subtle that if it's not happening very often, we don't recognize it. But imagine you're in an industry where every single day it's changing, you're having to adapt to changing scenarios, changing situations. That additional stress that causes does start to build up over time. And actually, industries where strain and burnout are considered normal for the sector. We did some work a couple of years ago with a video game developer and was talking to them about kind of stress and strain and burnout and what's referred to in their industry as crunch time. So when you're getting towards the deadline, the release of a game, it's called crunch time. It's where you just have to get it done no matter what. And they were saying, it's not uncommon for people to bring sleeping bags into work and they'll just sleep underneath their desk for a few hours. And then they'll get back up and go back to work because they don't have the time to go home. So actually, it's just easier for them to sleep at work for a few hours and then get straight back to it. And that was considered normal. That was considered okay because, well, the rest of the industry does it. And actually, not recognizing the impact that that stress and strain has on people. So If you're in an industry where all of these things are happening, all of these things are part of your industry, the case for mental health first aid becomes even more important because we need to be providing that additional support to people. So all of that's kind of looking at what the importance and the value of a good mental health first aid program. But what does a good mental health first aid program look like? So if you have mental health first aiders in place and you're thinking, well, I've got them, I don't know how effective they are though. This might just give you something to kind of think about and go back into your business or your organization and just have a think about and have a look at. First one, it's actually just choosing the right mental health first aiders. It's no good choosing a mental health first aider who actually doesn't have the time to do the role or doesn't really have the interest in doing the role. But it was 2 days of training, and that's 2 days out of my normal job, and it's just something a bit different. So I thought I would do it. You want people who are passionate about this, you want people who care about it. We'll touch about that a little bit more in a couple of slides' time. Second one, you need to be able to support your mental health first aiders. It isn't enough to go, right, we've trained you up, you've had a couple of days training, off you go, best of luck, because they're going to need ongoing support and you don't know what kind of things they're going to come across. So again, we'll talk about this a little bit more in a couple of slides' time. The third one is monitoring the data around well-being. How do you know that it's having an impact? How do you know that mental health first aid is working for your business? Well, the way of doing that is looking at the data that we have or seeking out data if we don't have it. And we'll talk about that in a moment as well. So choosing the right mental health first aiders, that's the starting point. There are some key questions to ask here that can just help you with that decision. And that first one is, does this person have time to step away to support others? You might have someone who is the ideal candidate. They are compassionate and empathic, and they really care about their staff and their teams, and they're just the perfect person for it. But they're always so busy. If someone came to them and said, "Can I have a chat? I'm kind of struggling," that they would go, right, okay, well, the rest of my day's full up of meetings, and tomorrow I'm out of the business, so can you do Monday? You want someone who actually is able to make time for it, even if they are the best candidate in terms of their personality and their ability to listen without judgment. They need to have the time to do the role. So I think that's an important consideration. Do they work in an environment that makes them accessible to others? We want people to be able to take the opportunities to go and say, can I have a chat? Or someone who's actually able to be able to notice when someone else isn't okay and to initiate that conversation. If you've got someone who works in the office, but they stay in their own little office upstairs and they never see anyone else, well, they're kind of removed from what's going on a little bit. Or someone who's remote working all of the time, again, they're not forming those relationships with colleagues as well necessarily. So they're not necessarily as approachable. So it's important that are they in an environment where they're accessible to people? And do you have representatives from across the organization? So I would say people from senior leadership all the way down to the ground floor. You want a nice mixture of different people throughout that. Senior leadership, I think it's always good because it's good to have somebody who understands what mental health first aid is, who understands the culture that you're trying to create, and is able to do that from the top down. But you also need people who are going to be approachable. If the only mental health first aider you had in your organization is your CEO, how many people are going to feel comfortable to go and talk to them? But they might feel comfortable to go and talk to someone who's on their level, who has the same job role as them. So having this mix throughout your team means that actually there's always someone that somebody feels comfortable to go and talk to. And looking at the key skills that we'd like them to have, good listening skills are the foundation stone to this. We want someone who's able to listen well, but actively listen. So not listening just to respond to someone, but listening to really understand. Someone who's willing to hold silence with someone, who's willing to let that person have the space to think about what they want to say and give them the space to say it. Sometimes we have people come along who want to be mental health first aiders and they're incredibly talkative people and they like to dominate a room and dominate a space, not from any sort of negative or malicious way. They're just very talkative people. But what that can mean is actually there isn't enough space for the other person who needs to talk. So they need to be able to listen well. They need to be able to sit with deep emotions. Can you sit with someone who's sad? can you sit with someone who's crying? I think that's always a good test for someone as if someone was sat opposite you in floods of tears, what would you do? And a lot of the time people go, well, I'd try and comfort them, I'd try and make it okay, I'd tell them it's going to be fine. Actually, could you just sit there with someone crying until they finish crying and not try and fix it and not try and make it okay? Can you sit with some of these challenging emotions? And do you have a real desire to help other people, to want to support others? Not do it because it makes you feel good, but because you really want to help someone else. And can you stay out of judgment? If someone is saying, I feel really worried and I'm worried about this, and you think, well, I wouldn't be worried about that. That seems like a silly thing to worry about. Can you stay out of judgment and not respond from that place? So that the person who is experiencing whatever it is they're going through doesn't feel judged and feels that actually what they're going through is valid and it's not being minimized. So those are some of the key skills I think we want people to have. You will often find that there are more people volunteering to be mental health first aiders than you have spaces on your training. So it's important just to be a bit more discerning about who you put on it. It's okay to be choosy about who you put on a mental health first aid course. If someone has had their own struggles with their mental health, a lot of the time that can be a motivation for them to want to do it. Well, I've struggled before and I found it really helpful when someone supported me, and now I want to give that back to someone else. I think that's a perfectly valid motivation for doing it. There are a couple of things to be mindful of with that. It's important that someone isn't going, well, I've been through it, so I know everything, and so I can support someone else, because actually your experience might be very different to someone else's. So it's important that they're not going, well, I experienced it, and this is what helped me, so I'm going to tell everyone that that's what they need to do. You can share your experience. It's important to recognize that everyone is different. The other thing that's really important to recognize with that is that the person has to be in a stable enough place themselves. It has to be something they have come through and come out the other side of. Because having something to draw on from empathy is really useful. But if you've got someone talking about something that's really challenging for them and it's catching for you, that's impacting your well-being and that's not good for you and it's not good for the other person. So they have to be in a stable enough place that they feel that they can stay out of their own emotions to be there for someone else. The second point that we mentioned, the second thing to be aware of, was supporting your mental health first aiders. And this was actually one of the key reasons we got into mental health first aid at Red Umbrella and to mental health first aid training is we sort of looked at the training and we noticed something very important was happening, or something potentially quite important was happening, in that people were doing the mental health first aid training and then it was, okay, off you go, best of luck. And they'd done 2 days worth of training, which there's a lot to take in 2 days. And then they were being expected to deal with whatever comes along. And that could be someone coming along and saying, I'm just feeling a bit stressed lately. Or it could be someone coming along and going, I'm completely overwhelmed. It could be someone coming along and saying, I feel suicidal. And that person is expected to deal with that based on 2 days worth of training. And there wasn't necessarily the support being put in place for that. That's one of the key sort of aspects of our training is the aftercare support, where we say to people, if you've done the training with us, you can pick up the phone to us at any point. You can drop us an email and you can say, I've got this situation. I don't quite know what to do. I need some advice and guidance, and we'll talk you through that. We'll help you through that situation. We'll help you explore the options. And then you're supported in being able to do that. So you kind of feel like you've got that safety net there. And if you find that actually as a mental health first aider, your own mental health is being affected, we'll put you in touch with one of our counsellors or therapists so that you can get support for that as well. And that aftercare support was why we got into training, because we sort of recognised that it's really important that that's put in place, that we are looking after mental health first aiders. They've volunteered to do this job in the most likely scenario. They've volunteered to do it. We need to take care of them so that their well-being is not affected. And as a business, that can be making sure that you've got line managers checking in with their mental health first aiders to make sure that they're okay. It could be HR staff making sure they're having regular conversations and checking in, but understanding what workload they're taking as well. And we'll sort of touch on that a little bit more when it comes to data, but understanding what your mental health first aiders are doing means that if somebody is having 10 conversations a week, we need to check in with that person. Are they okay? Because that's incredibly emotional work. How much are they taking away with them? How are they looking after their own well-being? If mental health first aiders aren't supported, they lose enthusiasm for the role very quickly. They want to feel like they've done this training and they want to put it in practice and they want to feel like they're being helpful. And whether that's having one-to-one conversations or whether that is getting involved in creating a positive mental health culture, they want to feel like they're doing something useful with their skills. I think all of us can relate to that. I think when you learn something new and then you never get to use it, it feels unsatisfying. And so supporting them is about encouraging them to get involved when it comes to mental health initiatives, get involved with things like mental health awareness days, get involved with having drop-in sessions for staff or communicating what mental health support is available, but also just making sure that you're looking after their well-being too. And there are kind of sort of four aspects to looking after and supporting your mental health first aiders that I wanted to touch on. The first one is empowering them to play an active role. So, as I mentioned, it isn't just about having those conversations. Get them involved in things like mental health awareness days. And there are lots of different ones throughout the year. You can find ones that actually really resonate with your industry and your business. Get them involved in that. Get them involved in raising awareness around mental health, starting those conversations, encouraging those conversations. Give them a forum to share their ideas and best practice with each other. So just having, whether that's once or twice a year, just getting your mental health first aiders all together in one place and get them to share what's their experience been like. What are the challenges that they're facing? What are some of the barriers they've come across? But also, what have you done that you think works really well? And I think it's particularly true and particularly useful if you've got mental health first aiders at different locations across different teams and sites, because someone might be doing something in one team that actually would benefit all the others. And when you get them together and they're sharing their experiences, people go, "Oh, that's a great idea. You go, we could do that too." And people start to learn from each other. And if you're facing a particular challenge, you're all there as a team to be able to tackle that and go, okay, what can we do about this? We're finding that actually people aren't coming forward as much. Okay, what could we do about that? Well, what if every sort of month or every couple of months we had drop-in sessions where we had just a couple of hours where we made everyone aware that mental health first aid is going to be there. If you want to just drop in and have a chat, feel free to do so. Would that encourage more people to come forward? And you can kind of explore that. And then when you come back at the next one, you can look at, okay, did that work? What worked? What didn't? What can we do next? But giving them that forum to share ideas, to share challenges, and share best practice is incredibly valuable. It also shows that you're making time for them as well. You haven't just trained them up and then forgotten about them. And mental health forums are things that you can do yourself. It's something that we come in and we do for other organizations as well. The one thing I would sort of say about this and kind of about any sort of initiatives that you do is don't be put off if actually doesn't seem to, it takes a long while for it to gain traction. We'll talk about that in a moment, but things like forums, you have to find very engaged. People want to be part of it. There's lots of different things you can do with that. You can use it as an opportunity for additional training as well. We've gone into companies who've done mental health forums and just done a little bit of an upskilling session, and they find that actually it just helps to refresh their skills, and they really appreciate that. Checking in with their well-being on a regular basis. Ideally, we want to be checking in with all of our employees' well-being on a regular basis, but it's recognizing that mental health first aiders are doing a very emotive role. We want to make sure that they're supported. Make sure you've got some way of tracking their workload as well. So we provide things like bespoke platforms where you can see what conversations mental health first aiders are having and what some of the issues are that are being raised. But a key part of that is knowing how much work your mental health first aiders are doing. Because if you've got one person having lots of conversations a week, we want to make sure that that person's okay, that they're not overwhelmed by it. And the last one, encourage them to keep learning and developing in their role. I always say, I think if you are the person responsible for implementing mental health first aid training, there's sometimes this kind of expectation that all of the ideas have to come from you. So whatever happens next, you've got to implement it. Once you've got your mental health first aiders trained up, you've got a team of people there who understand mental health and are in a really unique position to be able to offer that support in terms of just ideas and things that you can come up with. So encourage them to keep developing, keep learning more, do additional training if it's available, but also to come up with ideas that you as a business can implement to make it a mentally healthier business. And if you've got a team of mental health first aiders, you've got all these different perspectives and experiences and ideas that can come up. And as I was saying, mental health first aiders are really only as effective as the support that you give them. So Ask them what steps they can take to help promote positive mental health. Get them involved. It helps them to feel like their opinion is valued and appreciated, and you'll get some fantastic ideas that come up from your mental health first aiders. The third point to touch on is just monitoring the data. It is a financial investment you're making, so how are you going to tell that it's making a difference? How are you going to tell that it's working? What information might you have access to? So we talked about things earlier on about absenteeism and the impact that poor mental health has on that. You will have access, presumably, to your absentee records. So when you've got mental health first aid in place, you might be able to see that actually absenteeism starts to drop. You might find that actually, if you do employee surveys, if you do engagement surveys once a year, you might find you're starting to see things there as well. There's possibly things you already have in place. I'm going to give you a few ideas just in case you haven't, but simple things like monitoring the number of conversations your mental health first aiders are having. If they're having a lot of conversations, it means there's a need for it. But what you might find is they have lots of conversations at first, and then sort of 6 months down the line, that's starting to drop off a bit. Now, that might mean actually that they're proving really effective. They're having conversations, they're providing support, the signposting's becoming more well known, and actually finding they're not needing to have as many conversations. You can look at things like productivity. If you know that actually we've had mental health first aid input in place, can we see a difference in productivity? Are employees more engaged? Are we seeing a reduction in staff turnover? We can ask our employees. One of the things that we do going into other organisations is to do employee surveys and wellbeing studies. And part of that is because employees don't always want to engage with wellbeing studies from their employer because they don't think it's confidential, even though almost always is. They don't feel as comfortable to engage, but they're more likely to engage with an external organisation. But the data that we get back from that is really valuable because it helps you to understand what do they value about your organization? Do they understand the support that's in place? Do they know how to access it? Do they feel like they're valued and cared about? What areas would they like to see developed? What can you do next? So employee surveys are a really simple and easy way. And again, something you can implement yourself, something you could get us in to do or someone else to do. But they give you that data that you then can know what can you do next. And actually, just asking your mental health first aiders, what kind of things are you dealing with? What kind of things are you finding are coming up in your conversations? Are there any themes or patterns there? Is there anything that we as a business can then do something about? But knowing the data, having that information, knowing what kind of conversations your mental health first aiders are having, you can see that pattern change over time as well. Okay, we've had lots of mental health first aiders having conversations about stress. So now we've implemented some stress awareness training, some resilience training, and now what we're finding is the mental health first aiders are having less conversations about stress. You can see that something you've put in place has had a positive benefit. The more data you've got, the better it is. So I think use all of these kind of things you have in mind. Some of these are going to be longer term. Some of these are going to be shorter term. So the number of conversations being had by mental health first aiders, employee surveys, asking mental health first aiders what conversations they're having, that gives you data in the moment. That gives you quite quick answers as to what's going on and whether something's being effective. Absence reporting, KPI, staff turnover, they tend to be longer term measures, but they're still worth doing. It just means that you're not going to get the data from that. You're not going to see the shift from mental health first aid particularly quickly. But the ones in bold, you'll start to see that it's having an impact quite quickly with that. And don't worry if it takes a bit of time for employees to engage with mental health first aid and any initiatives that you put in place. It can take a while to start to see that engagement. And it comes back to that stigma again that people, if you say, okay, we've got mental health first aiders, so if you're struggling and you just need to have a chat, you can go and talk to someone. A lot of the time people will go, well, I don't want to be the first one to do that. It can take a bit of time for people to start recognizing it's okay. And sometimes people are thinking, well, is this just a one-off thing? Is this just a fad? Is it a tick box exercise from my employer? But if you are repeatedly getting that message across that there is support here, we've got mental health first aiders, and your mental health first aiders are getting active in terms of awareness days and engaging with the wider workforce, after a while people go, oh, well, this isn't a fad. This is not a tick box. This is something they genuinely care about, and they'll start to engage with it more. A simple example I have for this is we started doing mental health forums for a company. And first time we did it, we did it every month. It's a monthly thing we've been doing for about a year and a half. First time we did it, 4 people attended. And one of those was the person who'd arranged it all. Second month, 5 people attended. Third month, I think we were back to four. And then it was kind of six, and then eight, nine, 10. The last one I did last month had about 56 people on it. It was getting regular engagement now, but it took about a year to get to that point where people were regularly coming along to talk about their role and talk about mental health first aid. It took a while for people to engage with it, and you often find with mental health it does. It doesn't mean that mental health first aid isn't working for you. You might have to be a bit patient in that regard. But if you've got an initiative and you've tried it and it doesn't feel like it's getting any kind of traction, stick with it. Give it a little bit longer. Give it a good 6 months to see, okay, are we getting an increase in engagement? If you are, great, carry on doing it. You often find by about the 12-month mark, people are much more engaged with it. You just have to be patient with that. So do have that patience. Don't worry if it's taking a bit of time. And the last point that I've got for you is don't be afraid to reach out for advice and guidance. So here at Red Umbrella, we specialize in working closely with organizations. We like to think of it as a partnership. We kind of don't come along with sort of off the shelf things that we do. We like to understand your business and we like to help support you in that. So if you've just got some questions about, well, I've got mental health first aiders and I don't think we're really making the most of them, what can we do next? We're more than happy to have a chat with you and give you some ideas and suggestions of things you can do. Or if you're thinking, actually, I'm thinking of doing mental health first aid, but we've not got anything in place and I don't really know how many mental health first aiders should we have? What kind of training should they do? Give us a call, drop us an email, get in touch with us. We'd love to have a chat with you about your organization and what those needs are, and we can help provide advice and guidance. And if you need anything like training, we're there to provide that as well as that aftercare support too. So do get in touch. We would love to hear from you. That is everything that I have to give you in this recorded session. Unfortunately, in the live session, we were able to do a question and answer at the end. And obviously, you're listening to this not live. So if you have got any questions, do please get in touch. Do drop us an email. I'm more than happy to answer any questions that you might have. Thank you very much for listening. I know it's quite a long session and there's a lot to take in there, but I hope it's been valuable. And I look forward to speaking to you all at some point in the near future, I hope. Bye for now.